Member for Maitland.
Thank you, Madam Assistant Speaker. Since I arrived in this place, I have to say I've actually been quite appalled at the attitude of this government in relation to health issues in my electorate. Labor's got a proud tradition of delivering for Maitland. In the 54th Parliament, Labor's last term in office, over $300 million was delivered, including the third river crossing, a contribution to the Hunter Expressway, and both of these were both crucial to the floods that we recently suffered in my community. I draw the House's particular attention to Labor's record on health, specifically the $10 million upgrade to the Maitland Emergency Department, which Labor delivered in 2011, and which I'm told created 13 brand new treatment spaces as well as 12 new beds and 300 jobs during the construction. Now, to compare this with the Baird Liberals government contribution in the last Parliament, the 55th Parliament, as I mentioned in my inaugural speech, the only full acquittal of the $80 million of promises made by the Liberal government at the last election was the $5 million to the Maitland City Council for the levy bank project. However, it must be noticed that this was only a low-interest loan, so they will get the money back. So really nothing has arrived. Not only have the Liberals cut our health budget and cut community counselling, but they're playing games with our hospitals. And this is really getting to the heart of why I was removed today from the chamber, Madam Assistant Speaker. The government's been very secretive about the model that they want for this hospital. They keep trying to tell us everything will be okay because the Mater Hospital in Newcastle is a private-public partnership, but they forget to mention that that's a legacy model and that nuns aren't building hospitals anymore, and it's more than likely to be built by a private for-profit operator such as Ramsay or Healthscope, such as they've done in Frenchs Forest. The PP model means decisions about care and service levels are operated by for-profit and have no mandated staffing ratios, only the standard of adequate with no reporting, and this is an extreme concern when we've already seen the Maitland Emergency Department going into code red over the Christmas period in 2014. And then in addition to this, they want to close our existing Maitland Hospital. So when the new Lower Hunter Hospital was first promised, it was going to be an additional resource to our community. It was going to be, and I quote the members for Maitland and also the health department people at the time, a John Hunter-sized tertiary hospital. Now, 4 years on, we've got no time frame for that hospital to even begin, and it's going to be about half the size that it was actually promised to be, and now they're going to cut our existing hospital. So instead of a tertiary public hospital, in addition to an existing public hospital, we'll have a two-tier, second-tier rural referral PPP hospital with a helipad, so we can get the complex cases out quickly because we won't be able to deal with them there. And for all the people going down to the Mater for cancer services, you'll still be going there because they won't be delivered there in the short to medium term. Now, the Baird Liberal government's done nothing about our health system for the last 4 years in Maitland. They've sat on their hands, and all we've got to show for it is a $6 million sign at Metford. And, Madam Speaker, I was ejected from the House in question time when I interjected on the Minister for Health and the Deputy Premier's responses to questions about rural and regional health initiatives and other health initiatives, and neither of them included any mention at all of this Maitland Hospital, which they've now been promising for over 4 years. It's time to really just put up or shut up, essentially. Earlier this week, I asked in very good faith a question of the Minister for Health regarding the anticipated timeframe of the opening of the new Lower Hunter Maitland Hospital. The question is of a vital importance to my electorate, and as such, I think it's appropriate that the Minister should have answered it with civility and clarity, but instead we got an arrogant, when it's built response, an arrogant response. The former member for Maitland was constrained in her ability to raise these issues with the government as she was a member of the Liberal Party. However, I will be keeping the government to account on their promises on health, and I demand on behalf of my constituents to know when the new Lower Hunter Maitland Hospital will be completed and get a commitment from the Minister for Health not to close the existing Maitland Hospital. Thank you.